NCLEX RN Practice Exam Free 2026 questions to test your knowledge. Question 1. What is the primary reason for administering Lugol's iodine solution to a patient before a subtotal thyroidectomy? Option A. Decrease the total basal metabolic rate. Option B. Maintain the function of the parathyroid glands. Option C. Block the formation of thyroxine by the thyroid gland. Option D. Decrease the size and vascularity of the thyroid gland. The correct answer is option D. Decrease the size and vascularity of the thyroid gland. Iodine solutions, Lugol's, are used preoperatively to reduce the vascularity of the thyroid gland, thereby reducing the risk of hemorrhage during surgery. Question 2. Which of the following conditions can also lead to acute hypoglycemia? Option A. Liver disease. Option B. Hypertension. Option C. Type 2 diabetes. Option D. Hyperthyroidism. The correct answer is option A. Liver disease. The liver stores glycogen. Liver disease can impair the body's ability to release glucose, leading to hypoglycemia. Question 3. Which systemic side effect should the nurse monitor for in a patient receiving chemotherapy for metastatic carcinoma? Option A. Ascites. Option B. Nystagmus. Option C. Leukopenia. Option D. Polycythemia. The correct answer is option C. Leukopenia. Chemotherapy causes bone marrow suppression, with leukopenia, low white blood cell count, being a common and dangerous systemic side effect. Question 4. What should the nurse suggest to a colostomy patient to help control the passage of gas? Option A. Eliminate foods high in cellulose. Option B. Decrease fluid intake at mealtimes. Option C. Avoid foods that in the past caused flatus. Option D. Adhere to a bland diet prior to social events. The correct answer is option C. Avoid foods that in the past caused flatus. Gas production is highly individualized. Avoiding specific foods that the patient knows cause gas is the most effective management strategy. Question 5. Which statement by the patient indicates that instructions for colostomy irrigation have been understood? Option A. I should lie on my left side while instilling the solution. Option B. I should keep the irrigating container less than 18 inches above the stoma. Option C. I should instill a minimum of 1,200 milliliters of solution. Option D. I should insert the catheter deeper if cramping occurs. The correct answer is option B. I should keep the irrigating container less than 18 inches above the stoma. The irrigation bag should be hung no higher than 18 inches to prevent the solution from flowing too quickly, which causes cramping. Question 6. Which intervention is part of the prescribed therapy to correct electrolyte imbalance in a patient in the oliguric phase of acute tubular necrosis? Option A. Administer K-oxalate. Option B. Restrict foods high in protein. Option C. Increase oral intake of cheese and milk. Option D. Administer large amounts of normal saline via IV. The correct answer is option A. Administer K-oxalate. In the oliguric phase, hyperkalemia is common. K-oxalate, sodium polystyrene sulfonate, is used to remove excess potassium from the body. Question 7. The physician orders 2 liters of 4 fluid to be administered Q12H. The drop factor is 10 GTT/milliliter. The nurse should set the flow to option A 18 GTT/min. Option B a 28 GTT/min. Option C 32 GTT/min. Option D 36 GTT/min. The correct answer is option B 28 GTT/min. Calculation: 2000 ml 10 GTT / 12 hours 60 minutes equals 20,000/720 equals 27.7, rounding to 28 GTT/min. Question 8. According to the rule of nines, which area has the largest percent of burns in this patient? Option A. Face and neck. Option B. Right upper arm and penis. Option C. Right thigh and penis. Option D. Upper trunk. The correct answer is option D. Upper trunk. The upper trunk, anterior, represents 9%, or the entire anterior trunk represents 18%, making it larger than the individual arm or head percentages.